Hello, welcome. Thank you all for being here. This is our first teach-in in 2026 with the Mobilized Maternal Health Coalition, and this one is called Policy and Legislative Frontlines. It's about taking a clear, honest look at where New York is legislatively on midwifery, postpartum safety, and perinatal justice. So this is something that sets us up for action in the next few weeks. You guys might know about our Day of Action on May 5th, International Day of the Midwife. So we know the stakes. Black, brown, immigrant, and Medicaid insured families are facing preventable harm in pregnancy, birth, and postpartum especially. And not because we lack solutions, it's because our laws and budgets and rules haven't caught up with our communities and the solutions that we already know work. So one of them is clearly, ever so clearly, community-based midwifery, MMHCPMs, right? Doulas, and culturally rooted care. So this teach-in is a lead up for our Day of Action, May 5th in Albany, and to all the organizers and organizing that will continue long after. So we ultimately reflect on where are we legislatively, what's moving, what's stuck, and what does that mean for our advocacy right now? So you'll hear some updates. Each will touch on a different part of that answer. First up, we'll have NYCPM, who is very much a core part of Mobilized Maternal Health Coalition. They will ground us in what's going on with the CPM licensure bill being shepherded through Senator Amy Pollin's office, what's changed in the bill language, what feedback we're getting from state education, and what the realistic next steps look like. And we need your support. We need community to have an awareness of what this is and where we're going so that we can walk together. Then Push will zoom out on the topic of paid family leave, considering why and where the no-brainer of making sure that people who have suffered adverse pregnancy loss, how they should be treated. And this strategy starts at the city and state and county levels, and we need to inform families and communities where we're at with that. Samantha Bandery will also speak on behalf of the wonderful organization Speak, Move, Change. You guys may know, lifting up National Postpartum Awareness Week, which is right around the corner, and you'll hear more about that. And Kennedy from Ancient Song and representing also Birth Justice Institute will offer a snapshot on Medicaid reimbursement, informed consent, and movement-rooted policy training through the Birth Justice Institute's awesome pathways, and how we don't just react to policy, but we train up community leaders to help shape it. And finally, on behalf of MMHC, we'll connect some threads and share a little teaser about the collaborative policy efforts on community midwifery access and Medicaid innovation, and how we might align CPM licensure, payment reform, and postpartum justice in a statewide strategy. So that's the gist. We got 30 minutes with our first group and about 5 to 10 minutes for the other 3 announcements. Hope you guys are ready to listen and engage in the chat. Thank you so much. And with that, I'm gonna pass it over to Tisha Graham and Danielle Kitt and Melissa Carmen, who are CPMs and part of the New York Certified Professional Midwife group, who is really holding down the fight in so many ways that we need. All right.
Mila, thank you so very, very much for that overview of a beautiful introduction about MMHC and all of its component parts. New York Certified Professional Midwives are really honored to be part of this growing coalition and this very powerful coalition to move maternity care issues forward in New York. Many of you are familiar with certified professional midwives. We wanted to do just a very quick overview by clicking through some slides to let you know a little bit about who we are, what we do, how we're trained, to give that backdrop in terms of what some of the maternity care crises are in New York, which of course many of you are already familiar with. And then I want to provide an update in terms of where we are with our current legislation. The CPM licensing bill is co-sponsored by Amy Paulin in the Assembly and by Julia Salazar in the Senate. So after we click through a couple of slides that just give you a little bit more of a background and some information about who we are as midwives. All of us here on the screen today are certified professional midwives. And unfortunately, in New York, we are also considered felons. In fact, we have one such felon with us today, one of the midwives who got arrested a couple of years back for for not even serving her community, just being in touch with midwives who were serving their community. So we'll talk a little bit more about that. For those of you who may have had the opportunity to see the film, Arrest the Midwife, it is screening in New York City. And when Mila comes back, she'll talk more about that screening on April 30th. That will feature Melissa Carmen, who's with us today because she is one of the midwives who has been arrested. So without further ado, Danielle, I'm not sure if you can share our slides and we'll...
Yeah.
Great. Thank you so much.
All right. Give me just a second here. Well, okay.
Sorry to put you on the spot with the
sorry. Here we go. Okay. All right, give me just a moment here, and then I need to
Here we go.
Make this live. Where's my view slideshow? There it is.
There we are.
Okay, everybody good?
There we are. Thank you so much. And Danielle, I think you're going to take it over and maybe get started a little bit with some background on certified professional midwives.
Yeah, hi there, folks. My name is Danielle Kitt. I'm the secretary at NYCPM. And yeah, we're just going to give you a little bit of background again about who we are, and then we'll get into what's happening for us legislatively. So again, we're certified professional midwives. We are highly skilled, culturally competent providers that provide specialized care in the out-of-hospital community setting. As I'm sure everybody on this call knows, we can help address the New York's maternal health crisis in really significant ways. So we're just going to touch on a few of those issues. One, of course, maternity care deserts. If you're downstate, you may or may not know that 20 counties in upstate New York have no maternity care services at all. That means no doctors, no midwives, no birth centers, no hospitals that offer maternity services at all in those counties. An additional 21 counties have only one hospital providing maternity services. So that means that in upstate New York, one hospital or one regional, perinatal center could serve as many as 5 counties in upstate New York. And that can mean drive times of an hour, 2 hours, sometimes 3 hours to get to care in upstate New York. We know that 78% of maternal deaths in New York State are preventable with adequate care. We know that half of those deaths are associated with cesarean section. About 15% are associated with mental health conditions. About 50% actually happen in the postpartum period when people are least likely to receiving care, especially if they have, these long drive times, if there are financial challenges. I think it's a really common thing that if a family, can only afford to take their newborn to the doctor or take the birthing parent for their postpartum care, of course, everybody's going to take their newborn. And, and we can see how that plays out in New York State. And it's worth noting too, of course, as Tisha mentioned, and everybody is aware, our Black and Brown communities are hit, of course, the hardest with these statistics. It's 46%, I believe, is of maternal deaths are associated with probable or definite discrimination. And that's really significant in a place where CPMs can really step in because, of course, providing care in the community means we don't need a hospital to serve our, those 20 counties that don't have a hospital. We can fill in the gaps in those 21 counties that are, sometimes serving multiple counties. And of course, we're going to reduce the rate of cesarean section. We're going to be able to provide culturally competent care, often culturally congruent care, meaning that, someone from the community is serving the community, which of course is going to decrease the likelihood of any kind of discrimination or, and just improve the quality of care overall. So just quickly, what is a CPM? We are nationally board certified with the credential of certified professional midwife. We're educated to offer expert care, teaching, counseling, support to women during pregnancy, birth, and the postpartum period, and to their newborns for the first 6 weeks. We have particular expertise in community out-of-hospital birth settings, including home birth and birth center care. We specialize in low-risk populations, which is, 90% of the population, really. And we can really serve a lot of the community. All right, and I think, Melissa, you were going to take it over from here. Are you still on, Melissa?
I am. I just had to get unmuted.
Okay, so, no worries. Just wanted to make sure.
Yeah. Thank you so much for having us here today. I just want to talk a little bit about how the rest of the country is kind of handling things with CPMs and, what it looks like for us. We have 38 states that include, and Washington, D.C., that license CPMs or have a pathway for CPMs to practice legally. New York State is a little bit unique, actually a lot unique, in the fact that our rules and regulations that we have are in direct contradiction to the statute, which on some maps, you will see New York has it striped. And this particular map doesn't show it striped. But the reason was because there is some controversy about whether CPMs can actually practice in New York through an equivalency route for our education. So, but as you can see, the majority of the states do have a pathway to licensure. And we are also unique in the fact that we are the only state that falls under higher education. Other states fall under nursing, they fall under midwifery, some fall under medicine, but for New York State, we fall under higher education. And that has been a huge challenge for us. Hi, Melissa. Hi. Sorry. Thanks. Do I have to sign anything? No, you're okay. Thank you. Have a good one. All right. Sorry about that. I don't know if there was more I was supposed to talk about with that. Sorry.
I can click ahead.
Please.
Okay. All right.
Melissa, did you want to keep going on this, or do you want to? I see that you're driving.
Well, no, I'm pulled over.
Oh, good. Okay,
it's great. With my bifocals, it's a little hard for me to see the screen. So,
that's okay.
Unfortunately.
Why don't we read this and then you can hop in, since the next couple of slides are a little more directly associated with your experience.
I apologize.
That's okay. So California, which has the best birth outcomes in the nation, also has at least 500 known licensed CPMs integrated into their maternity workforce. So they have 500 more providers throughout the state. What would New York look like if we had 500 more providers than we have right now? So we wanted to touch on this, we call it a pilot program. So during the COVID pandemic, there was an executive order that was issued in March of 2020 that allowed any medical provider licensed in another state to legally practice in New York State. So that meant that CPMs that were licensed, many of our NYCPM members are licensed in neighboring states like Pennsylvania, Vermont, Massachusetts, Rhode Island. And they were able to practice legally in New York State under that executive order. During that time, a small group of midwives in central and upstate New York gathered their statistics. And we actually pulled out 3 of those midwives' stats because they all were in kind of the same area, so that we could give you an idea of what their stats look like compared to the local hospitals. So in 2021, go ahead. You want to take over, Melissa?
I just want a quick little correction in case somebody catches it. There's no licensure for CPMs in Pennsylvania.
Oh, in Pennsylvania, you're right.
Yep, apologies.
I thought that as I was saying it, actually. I was like, wait a minute.
Yeah.
That's okay, though. So in 2021, these 3 CPM midwives attended 303 births. They had a transfer rate of 3.5%. That includes both maternal and infant transfers, and a cesarean rate of 3%. In 2022, those same midwives attended 274 births. They had an 8% transfer rate, again, both maternal and infant, and a 1.5% cesarean rate, which is phenomenal. I mean, I feel like 4 is really normal, and 1.5 is just kind of amazing. And just by comparison, the hospitals in these areas, Wayne Newark is a 300 bed hospital. They average 500 to 550 births a year, and their cesarean rate is 21 to 25%. Thompson Hospital is a 113 bed hospital that averages 600 to 700 births a year, and they also have a 25 to 30% cesarean rate. So much higher cesarean rate, but also if you just look at those numbers, 3 midwives attended half as many births as the local hospitals. I mean, what could we do if we had 500 more midwives doing this? And worth knowing that 2 of those 3 CPMs actually were CPMs who were arrested, and so are not able to serve their communities in the same way that they were before. And do you want to hop in on anything on that, Melissa?
Sure. Obviously, it was very exciting to hear that we could practice in New York State and serve the people we needed to. In particular, just very, very quickly, I was arrested for text messaging with another CPM, which was Elizabeth Catlin, who's the main person who was the focus of the film was on. So just that communication through text messaging, I was convicted of unlawful practice of a profession for aiding and abetting. And all we were doing was just talking shop, which all of us do on Facebook all the time. So even during the pandemic, and even though there was an executive order, I was almost arrested a second time for practicing without a license. And luckily, that executive order prohibited the police from arresting me. We can make such a difference, which, these are only just a few of the stats. I'm not in New York State anymore because I would get arrested and thrown right in jail. But I serve about 200 families a year as a single provider in another state. And it's very sad that a lot of the people that I serve have to come all the way from New York because there are no options. So we need the voice of the people to come out and to let our legislators know, let the state education department know that we need more midwives. And it's going to happen because of the consumer efforts.
Great.
All right.
There we are. We need more midwives. No question about it. Obviously, the gaps in maternity care and the lack of access to those type of midwives that are specifically trained in out-of-hospital home birth, birthing center birth, are not available in the communities in which they hail, from the communities in which they hail, as well as in the communities in which they serve. And that really is a pivotal point with regard to outcome and regard to satisfaction and regard to health and well-being, not only of the family, but also of the community. So let's go on to the next slide, please, Danielle. So let me stop here because this is the focus, for our next couple of few minutes will be, we're going to wrap up, in the next, 5-7 minutes so that we can have some Q&A. I don't know if that's possible on this platform, but I want to give others a chance to share what's happening with them legislatively. That's our focus today. So one of the big things that I think folks can do is to join us on May 5th, because on May 5th, we're going to gather at the state capitol on the $1 Million Staircase. We're going to have a rally at 11 o'clock on the morning of International Midwifery Day to call for more midwives serving more families across the state. Legislatively, we have our bill. It's the Assembly 1125 and the Senate 5542, the CPM licensing bill. As Melissa explained, New York is unique in that our bill comes under the Education Department, the state Education Department. For the first time in several years, we've been pushing this bill legislatively for about 5 years now. And for the first time in several years, the members of the state Education Department are sitting down with us to look at bill language and look at scopes of practice and look at ways that we may be able to tailor or temper or amend our bill to satisfy some of their concerns. Now, some of their concerns are concerns that we will not be able to really satisfy. For example, I'll give you an example of one that has come from the state education department before they will green light our bill to move through committees. Right now, our bill and has been in the higher education committee. And members of the Higher Education Committee in the New York State Legislature will not move our bill forward onto the floor for a vote until state education gives the green light and gives their, kind of stamp of approval. State education is asking for such things that NYCPM is really hoping to negotiate but unwilling to budge on. For example, we would like to be called certified professional midwives in New York, or even possibly licensed certified professional midwives in New York, which is what our title is. It's a national credential. It's not something that we would change the title of, but state ed would rather that we refer to ourselves as direct entry midwives. Now, direct entry midwives is a term that was commonly used before certification and credentialing was an option. And so we refuse to lay down the title that we go by, the title that we are certified through, the title that we are credentialed through. And that is a sticking point with state ed that we are in negotiation with. The other issue that we are in negotiation with state ed, which is currently holding up our bill, has to do with oversight, whether or not midwives need either written practice agreements or oversight by other medical or maternity care professionals is something that we were able to get rid of in the state of New York back in 2011. With the currently licensed midwives, we pushed a bill through the Assembly and through the Senate that allowed for written practice agreements to be removed from the criteria for practice. A written practice agreement essentially means that the midwife cannot practice unless she has a doctor or a hospital that has maternity care services, by the way, which are not available in 20 counties. But unless that midwife has a signed piece of paper that says that that doctor will take responsibility for her practice, she was not able to practice. We changed that law. We moved past that law in 2011. And the state education department wants CPMs to have to go back to that very restrictive criteria. And that is also something that we are in the process of hammering out and negotiating with them. So there are a couple of things that are just non-starters for us, sort of the offensive suggestion that we would need to be, we would need to have oversight by doctors. Again, we reminded them that in their own statute, they got rid of that. So that's probably something that we'll be able to resolve. So we're working on a couple of, kind of sticking points around the language. And I think one of the most important things that folks can do to help us move CPM licensure forward is to come out on May 5th And there'll be a flyer that you'll see before the end of the teach-in that gives details. We're meeting at the $1 Million Staircase. We're going to raise our voices. We're going to raise our signs. We're going to go then and meet with a couple of key players, key members of the higher education committees, to talk to them about putting the pressure on state ed to really come to their senses, come to some terms that we can live with, to move our bill forward and hopefully cross the finish line. If not in this legislative session, then certainly in the next legislative session. We don't even have a budget yet, so everything in Albany kind of gets backed up by that. So we are hopeful, eternally so, and we very much appreciate your support as we gather on the steps on May 5th to call for greater access to midwives, and certainly greater access to the community the community care that CPMs provide. So thank you so much for that. I think I'd like to see if there's any other comments that my colleagues would like to make, Danielle or Melissa, or again, I don't know if there's opportunity for a question or answer. So Danielle, would you like to add anything in terms of the outreach, or in terms of the way that consumers, you spoke, and I think Melissa as well spoke to how important it is for consumers and for families to have a very strong voice in this effort. Would you like to add to that?
Yeah, I think that, one piece just to hop on what you were just saying, it's really exciting for us, or for me, I guess I can't speak for the group, but it's really exciting for me that we finally are actually having a dialogue with SED. So in years past, there's been like this long waiting period, and we haven't gotten feedback on the right version of the bill. And this year we've actually had quite a few back and forths, and it does seem like they're really open to a conversation, which is, I just think is super exciting.
It's a huge development. And as you said, it's taken years for us to be able to come to the table with members of. Now, the other thing is that as an organization, as New York Certified Professional Midwives, we can't have direct conversation with members of the state education department. They are going through our sponsors. So we have lots of conversations with our sponsors and their staff, and then is the staff of the sponsorship of the CPM licensing bill that sits at the table with state ed. So there's a couple of steps involved in going in one direction and then coming back to us and then going back and forth again. So
I gave a telephone for sure.
Yeah, but we are in conversation. We are in, we are making some headway. We are helping them understand not only the value of having our ability to practice, but also the very specific and unique scope of practice that we bring to the community, specifically to Black and Brown communities and to religious communities who historically choose not to birth in the hospital setting, and again, obviously for good reason in many cases. So, Melissa, please add.
Yeah, I think we're running low on time, and I don't want to hold them up on
a few more minutes.
We have a tremendous amount of support on the Senate and Assembly. It's bipartisan support. But another thing that everyone can do is call their legislators. Make a phone call. Take 5-10 minutes out of your day to make a phone call to say how important this bill is. But we have a tremendous amount of co-sponsors on the bill.
Absolutely. Yes. Thank you so much for saying that, Melissa. And so I guess without further ado, we may pass it on perhaps back to Mila to transition us between our presentation and what follows. Again, thank you so much for the opportunity to share our background, to share our issue, and to engage you in kind of political action to help us move our licensing bill along. Thank you so much for this opportunity, and we'll be on for the rest of the teach-in. Mila, thank you so much.
Very, very happy and excited that we're having the opportunity to learn. This fight has been a long one, and we are turning that corner where the hope and excitement and faith and evidence of progress is really warming my heart and firing up a lot of the opportunity. And hopefully all the people who are here with us today watching are also equally fired up to get connected and take an action. And yes, I love that you're plugging May 5th. We'll talk more about that as a announcement at the end. So I'll pass it to Samantha. I need to be reminded. I want to say Samantha Bangery and Push for Empowered Health. And
hey, Mila.
hey, could you say it for us?
Samantha Banerjee. And don't worry, lots of people make that same mistake, which is pretty funny to me. So I'm here from Push. Thank you so much, Mila. Thank you to everybody from NYCPM for that amazing presentation. So I'm only going to stay on here for a couple moments today just to give you all a quick update on the state of the New York PFL after stillbirth bill, which unfortunately we don't have too much progress to report. So last June, these are a couple of slides just from our press release last June, the day after the session ended, where Albany, for the third year in a row, failed to pass common sense, common decency legislation that would protect New York's stillbirth moms from having to return to work only days after giving birth to what in many cases is a full-term baby. If you remember what this bill is about. So Cassidy, who is pictured here, is a member of our PUSH team. She is a stillbirth mom. Her daughter Olivia was born still at 36 weeks. And as she explains in the graphic, she carried Olivia for almost 9 months, found out that she had died, needed to deliver her, went through, over a dozen hours of labor, delivering Olivia vaginally, just like any other baby that needs to be born. That's why at PUSH we say stillbirth is still birth, because many people don't realize that babies born still need to actually still physically be born. And so as a result, Cassidy had all the same postpartum effects that any other mom goes through, on top of course, the incredible trauma and grief of losing her first child and having to bury her only days after giving birth to her. And to make matters worse, the day after Olivia's funeral, Cassidy came home and received a call from New York State saying that her paid family leave benefits, which she had been paying into the system out of her own paycheck for years, had applied earlier in her pregnancy and been approved and told that she could expect, $1,200, up to $1,200 a week for up to 12 weeks after giving birth, so that she could have the time she needs to heal her body, was being revoked from her because of a technicality in the bill that says that this is time for bonding with a baby. And so since, as New York State was so kind as to remind Cassidy she no longer had a baby to bond with, she no longer qualified for her paid family leave bills. Instead, they pushed her off onto the temporary disability system, which does thankfully cover stillbirth. However, temporary disability benefits have not been updated in New York State since I believe 1985. And so they are currently set at $170 a week. And so as the main breadwinner in her family, Cassidy was back in the doctor's office days after giving birth, begging for clearance to go into work because she could not afford to put food on her family's table, to pay her mortgage and her car payment and all of the stuff, if she wasn't receiving the $1,200 a week that her and her husband had budgeted around. And her doctor very reasonably said, Cassidy, if I sent you back to work, sooner than 6 weeks, like I lose my medical license. Like you just went through a major physical trauma of giving birth like any other parent. And also stillbirth moms are almost 5 times as likely to have severe maternal complications. And then on top of it, she's suffering from post-traumatic stress, from suicidal thoughts, from just incredible trauma and grief that no family should have to go through. And so who's in any condition to return to work at that point in time. And so what this bill is designed to do is to close that loophole so that anybody who is approved for paid family leave in New York and goes on to give birth, whether their baby is alive or has sadly died, still receives those benefits. Unfortunately, New York State chose once again to put the interests of the insurance and business lobbies over the lives of moms in our state. We have up to 4 stillbirths every day. Those moms are more likely, twice as likely to be Black. As we know, Black moms in New York are 3.5 times more likely to lose their lives as a result of pregnancy or childbirth, and up to 9 times more likely in New York City. And so there's a lot of overlap here between these groups that are at the most risk of losing both their babies and their lives, and then also the least likely to have other benefits from private employers or insurers or whatever available to them. And so this is basically, in short, completely shameful. Our entire community is outraged and incredibly disappointed and frankly just disgusted with how things have gone. That said, the fight is not over. So as Mila mentioned earlier, we will be going back up to Albany in May, on May 5th. And I know we'll share more about that in a few moments. We need people calling. The bill is still in the Senate and the Assembly, the same as last year, same numbers. And there's more information about this on our website at pushpregnancy.org/NYPFL. And I think we can also put that up on the screen here. But we would just encourage you to please call, email, tag on social media your representatives in the Assembly and the Senate if you are a New York State constituent. And also call the governor's office. Governor Kathy Hochul has the power to put this in this year's budget, which the last I heard still had not come through, even though it was due April 1st. And is working directly with the people in the Assembly and in these lobbyist groups that have the ability, that are blocking this bill from going through and keeping moms and babies safe. So yeah, please check out our website. There's tons of information on that page that basically documents the whole saga, and it is a saga of what has been going on with this bill. And if you can, we would love for you to join us in person or virtually if you can't be there in person on May 5th. Again, Mila will tell you more about our plans for the Mobilized Maternal Health Coalition trip to Albany in a few moments. And then I also just quickly wanted to share, so as I'm sure you all know, last week was Black Maternal Health Week. And so I am proud to be a member of the Speak, Move, Change Collective, which puts on a couple of events each year for both Black Maternal Health Week and then for National Postpartum Awareness Week, which this group actually created. So the Speak, Move, Change immersive virtual experience is going on actually right now. We had the first session on Sunday, and then day 2 will be tonight. This is free. You could totally hop in now, having not seen the previous ones, and you can actually They will be up on YouTube, so you can watch anytime. But this is a reproductive freedom train, which is an Afrofuturistic journey to liberation, where we stop at different stops around the United States, who are today, creating safe birthing spaces for Black, Indigenous, and people of color. And then also into we journey together into the Afrofuturistic world of Afroom, which is in 23, 26, where we can see what the vision of what we are working towards looks like. So it's really fun, especially if you are a science fiction nerd like me. So it kind of brings everything I love together. Please join us for that. And then coming up in May is, and actually during our trip to Albany, is National Postpartum Awareness Week. So this is a 7-day virtual series where we talk about all the different parts of postpartum that typically get overlooked in the United States. So this is the full schedule. There's a ton more information on the Speak, Move, Change website and an Instagram page. So please check it out. You can come for one night, all 7, whatever you want. There's different topics each night that cover different parts of the postpartum experience. But in general, the idea is to recognize where there are gaps in the care that families are receiving as they transition into this incredibly important experience, and especially around keeping Black and Indigenous and people of color safe, because the postpartum period is when we see the majority of maternal deaths happening. And so, this is the full schedule. And I especially wanted to call attention to the PAW event on Tuesday, May 5th, which is the same day that we are going up to Albany. So if you cannot make it to Albany, we totally encourage you, if you're down in the New York metro area, to attend this event, which is going to be in person in Brooklyn. It will be a hybrid event, so you can also watch live from wherever you may be. But if you can be there in person, the artwork of Omari Maynard, honoring the lost mothers that we have lost in the maternal health crisis in New York and in the entire country, will be featured. It's being co-hosted by Mothering Justice. And it's going to be a really, really powerful and awesome day. And so we hope that you guys can be there with us. And that's all that I had to share. So I'm going to pass it back to Mila to introduce our next guest.
Thank you. I love the work of Push for Empowered Pregnancy and Speak, Move, Change, and all the wonderful people making that happen. I hope people will attend. All right. So next up is Kennedy with Ancient Song, and they'll share with regarding the Birth Justice Institute, a snapshot of work on Medicaid, reimbursement, informed consent, and policy organizing training via the Birth Justice Institute pathways. And Kennedy, hello. I know regarding time, maybe we can veer towards 8 minutes if that feels possible. And just for the folks here, we know that after this, there's one more synthesizing of Mobilized Maternal Health Coalition, as well as some announcements ahead. And if you need to take 10 minutes, go right ahead. All right.
Green and see me. I can't quite see you all. So hi everyone, I'm Kennedy Austin. I'm a policy analyst at Ancient Song. Ancient Song is a national and local birth justice organization that aims to eliminate birth justice inequities through doula care and doula training, and through policy and advocacy. And today, I'm just going to talk a little bit about how we do that, and kind of how we aim to contribute that to the Mobilized Maternal Health Coalition and initiatives beyond that. So as an organization, we are mostly focused in our legislative and policy work on ensuring that there is community impact through localized grassroots efforts. Our goal here is to address healthcare disparities in maternal mortality by creating tailored community-led interventions that reflect the unique local needs of a population. We also aim to ensure that healthcare providers, community health workers, and doulas are equipped with the necessary skills to deliver competent patient-centered care while being held accountable for health disparities. Our third focus area is that collaboration. Our aim here is to leverage experts, birth workers, advocates, and community members to really come together and have conversations and actions that drive substantive legislative changes that address systemic barriers, ensuring long-term statewide transformation in birth equity. And then our final goal is to ensure that the maternal health health workforce represents the diversity of communities that they serve, fostering an inclusive environment that dismantles inequities in birth outcomes. So how do we do that? We do that through power building. Our overarching goal is really to build power among community, among providers, and among birth workers in general. We do that by offering tools, resources, and transforming trauma into reparations. Our goal here really is to meet direct needs while also convening space, offering knowledge and skill shares and different resources that help people be agential and self-determining in their own individual lives while also contributing to systemic change. So what do we mean by that? There's two ways to do this. There is base building and there's base activation, and they really function together. There's a couple avenues for that at Ancient Song. One is Doulas for Democracy, our organizing space. Another is the Birth Justice Institute, which is really kind of a organizing incubator, a movement incubator. And the Informed Consent Coalition, where we work together to end non-consensual drug testing and unnecessary non-consensual procedures that often end up in justice involvement and family policing involvement. And then we also have our Medicaid reimbursement efforts, which our goal really is to ensure that there is a greater diverse workforce that is also being paid well and sustainably and allows folks to flourish on both the client and birth worker end. So when we talk about base building and base activation, in base building, your goal really is to build power among communities and comrades. So you're gathering folks who have common interests to provide space and information on deep relationship building strategy and care strategies. With goal activation, you really rely on those built skills, strategies, and relationships to direct resources and actions towards change. It's really similar to mobilizing. It's kind of the same thing. You know, you're really mobilizing folks to do something, to direct their energy, to direct their resources. And power building is really that combination of the both, because the point really is to fortify us, to be able to have individual and community skills that allow us to turn away from certain things that are harmful, especially institutionally and systemically. So we do that by organizing and mobilizing. These two things are kind of similar in the sense that they work together. In order to mobilize, you need to be organized, and mobilizing often draws folks to continue that vision by organizing. Organizing is a permanent, sustainable power building force. The goal here is a liberatory vision, and we move through that by fostering solidarity and interdependence. With organizing, you also build power by growing people's personal capacity and skill and information and knowledge. And then you also use mobilizing to attract people to direct attention and resources towards something. Now, when it comes to mobilizing, it relies on those relationships, that information, those skills shared through organizing. It brings people together, it directs action, resources, and attention to an issue, and it relies really heavily on timing and context. A couple things that we do in order to build power, we really work heavily in framing and narrative work to offer birth justice timelines, personal histories of birth injustice, triumph, and really make that connection between theoretical, historical, and analytical frameworks to real life experiences in order to be able to evaluate program and policy. We also move from a space of research, data, and education. We really try to work towards utilizing quantitative, qualitative, participatory, generation, interpretation, publication, and collection. That's a lot of Asians. And but the goal here really is to be able to use information that we built ourselves that we can share with one another in community for immediate use in knowledge-based building. And then, like I said, organizing. Another tool that we use is mutual aid. By providing doula care from free to low cost, and then our giveaways and other different efforts that we do to ensure our coat giveaways. Our goal here is to operate alternatives that do not replicate institutional and systemic harm, right? We move that meeting direct needs away from powers that cause us harm. And then finally, we convene folks for legislative advocacy and action to educate policymakers on things like dignity in birth and obstetric violence, informed consent and family policing, midwifery and doula care access, Medicaid reimbursement, and workforce sustainability. We can skip this. So where do we do this? We do this in a couple fronts. Doulas for Democracy, which I described earlier. It's our organizing space. And one of the things I was going to talk about is that one of the things that Ancient Song provides is a container for convening. And what I mean by that is we offer the physical and emotional, mental space for folks to come together to discuss, to learn, to act and research. And we really aim to be that incubator process. And so Doulas for Democracy is one of our virtual and physical spaces that allows birth workers and advocates to come together. The Birth Justice Institute is another incubator space that is more focused on growing skills, knowledge, and information among birth workers and advocates about birth justice and legislation. And we also have the Informed Consent Coalition, where we are part of Movement for Family Powers initiatives to mobilize community members, advocates against non-consensual testing and procedures and towards harm-free healthcare and family-sustaining police policy and programming. And then finally, with Medicaid reimbursement, we do a couple of things. We provide research, data, technical assistance, and coalition advocacy to help increase the availability of affordable and sustainable doula care. If you have any questions, I think we're waiting towards the end. You can always email me at Kennedy@Ancient Song Doula Services or visit our website. And you can let me know if you want to get involved in some of our work. We will be also part of the May 5th advocacy efforts, and we love to struggle with but we love to be a part of the Mobilized Maternal Health Coalition. So with that, I will kick it back over to Mila.
It is incredible the work that is happening with Ancient Song and the Birth Justice Institute. And, you know, when we think about what Mobilized Maternal Health Coalition is, we are really doing something both simple and radical. We are working together. And however simple that is, we really appreciate the community becoming more and more informed. I'm just in awe right now of how all the groups who've gone, how rich the content is. And I just want to acknowledge that this is one teach-in, and we do plan to have another teach-in. So as I aim to synthesize some of what's happening with MMHC, and then we move into announcements and look if there's any relevant questions, comments in the chat, we could have some time for that and in the next 10 minutes, hopefully. So when we talk about maternal health in New York, we have to start with the truth that Black, Brown, immigrant, and Medicaid insured families are really having the greatest risks in a system that was not built with us in mind. And all of the solutions that are mentioned here really affect all people, but it's really important that our project be something that is in alignment with the fact that we need to center some of these solutions that ultimately make community-based midwifery legal, sustainable, and truly accessible across New York State, and do it in a way that's led by people most impacted. And I just want to shout out to the truth of just a simple thing that maybe many of us have experienced is loss of our community midwives who are incredible and who got into midwifery to support our community, but they've had to leave our state to serve in other environments. And we need them here. And so we wanted to give a little shout out to our midwifery policy collaborative in the making. And even though it's young in its path, it's really a collaborative experience so far. Student midwives, training in out-of-hospital birth, doulas, childbirth educators, even doula architect, right, who are really designing liberatory spaces, policy experts who've helped and just have a great awareness of how CPM licensure and birth center reform is a big part of what we can access. If these are proven solutions, we really want to see those solutions implemented here in New York State. And the families who've lived in the gaps of this system, we really want to do the work. And so part of what we hope you guys can do is stay in touch, right? There's some info about Mobilized Maternal Health Coalition.org and some related events. And we can go a little bit into announcing some of those events now. But again, like take a moment and reflect on what does it take for every family in New York to have safe, culturally rooted midwifery care that's close to home? And what does it take to make that the norm, right? Not the exception. And so part of what we're working on in hopes for, equitable Medicaid reimbursement, integrating CPMs into New York's regulatory landscape, having a comprehensive perinatal support package. We've dreamt up some ideas, and it starts with collaborating with listening at the core, and postpartum safety and the continuation of care for families in a very sensitive time, right? So this statewide effort is weaving together the power of these organizations that exist, some that may include, PUSH, NYSBCA, March for Midwives, even Beloved Birth, 50 by 50, which is part of the event announcements I'll make. But this is going to really help push for the facility, or for the statewide push for our facilities to be recognized and workforce to be developed, and everything that we really hope for, but we got to start somewhere. So announcements up. We can bring people back. And while we bring people back, if you have an announcement to share, make sure you just have it ready. What I'll start with is our next teach-in. I have a little agenda in the making here. It's a rough agenda, but it's going to involve the New York Birth Center Association and the overview of statewide landscape, and hear from the different birth center efforts that are happening individually, and Beloved Birth 50 by 50 film series, and Birth Around the Borough, ongoing story project gathering, and March for Midwives, a current campaign related to midwifery and birth centers, again, storytelling, and just plugging more events and ways that people can be involved. So with that, let's plug some events. We have May 5th. Who's coming? Raise your hands. I'm going. Yes. Okay. So we need, okay, you'll be there in spirit, Danielle. Even if anyone has I've been saying this to people with hopes that somebody out there is going to be like, yes, I'll pay $1,000 for a bus to get, up to 20 people up there who wouldn't otherwise be able to attend, because it's important that the families who are most impacted or who have personally experienced some of these stories are going to be represented as we have our day of action. So there's probably a link to that. The couple events that I want to plug right now, one is April 29th. It's a Meet the Midwives event that we're having in Anew. And let's see here. April 29th, Midwives Work Everywhere will gather home birth, student, hospital, and birth center midwives in one place, an opportunity for the wider community to engage in rich conversation and get connected with midwifery options for care and how they integrate into the New York City landscape of healthcare. Okay, this is in the Greenwich Village area. The following day after Meet the Midwives is, guess what? Arrest the Midwife screening, which is a film like was mentioned before, which highlights the issues that are happening right here in our state. And so this is a beloved birth 50 by 50 screening, and Birth Center Equity has partnered with the Birthing Place Foundation and Mobilize Maternal Health to uplift certain films that are highlighting some of the maternal health issues that we are experiencing. So this will be at Anew on April 30th. Guess what? We have it at an interesting time, 3:00, because we want our legislators to come. We want to really amplify the lead up opportunity. It follows the women who are breaking from tradition and emerge as political activists, and they are put in a position where they must join the broader fight for reproductive justice. And it highlights licensure and reimbursement rates that vary state by state, and the unfortunate fact that it leaves many people unable to practice legally and sustainably. And we're going to have a hybrid panel in person. We hope you can come in person, but we're going to have a virtual component so that our legislators can tune right in. And I think we may have dropped the info for that in the chat. There's the Beloved Birth 50 by 50, but the one that you see right there, the Luma, that's the one where you can register and come right to this wonderful space called Anew, who's hosting us for this screening in the West Village in Manhattan.
I guess I'll jump in with one more plug about Speak Move Change tonight and Postpartum Awareness Week in a couple weeks. You can register for those at speakmovechange.net, which will bring you to the Eventbrite, or this is the Eventbrite directly for the PAW schedule.
Tisha, you got anything? I know that there's something we want people to sign. Do we want to talk about that for 30 seconds or so? You're on mute.
Oh, I'm sorry. Let me see.
You're good now.
Am I back? There I am. Thank you so much. Yeah, NYCPM has a sign-on letter, a list of supporters who want to join our efforts to move CPMs into legal status in New York. I don't know if that's something that we are able to post here somewhere, like in the chat. Danielle, do you know if we can put that somewhere so that folks can take a quick look at that sign-on letter? Or, in fact, you can go to our website, NYCP Midwives. NYCPmidwives.org, and there'll be a link to sign on to that letter, as well as a flyer that gives you all the details for the May 5th Day of Action. And those are the two announcements that I think I'd like to make.
Wonderful. So we are getting to the spot where we just want to get people excited about what we're building here in New York State. This is not New York City. This is not upstate. This is all of the state. And with the Mobilized Maternal Health Coalition, we're uniting organizations, individuals across New York to advocate for policies that transform maternal health outcomes. Just think, expanded Medicaid, doula and midwife funding, postpartum care, community-led solutions, the things we want, right? And you should join us by coming to these events, by signing up for something. You'll really be part of shaping state level policy and amplifying your voice and this work, and be a part of a movement that's centering BIPOC, rural, and low income families that are not censored enough. So we hope that you join in the fight and start by just showing up.
And thank you for showing up today.
Yes. Thank you. See you at the next thing. Take care.